Right.
So my presentation is on the art and science of nursing. And it's an exploration of those facets of nursing and how those translate to hope in patient care. So my objectives for this presentation are as follows. I hope you'll be able to apply this case study that I present to you in terms of clinical practice, research, and ethics. I hope that you'll understand these facets of nursing that I'll present: science, clinical practice, research, and the art of patient care. I would like you to recognize how these facets are translated into nursing education today, and then how these translate to hope in patient care. So my case for you is a current 23-year-old here at SCCA. In 2002, he's a 14-year-old male diagnosed with AML. He failed 2 inductions with no response, and his 3rd induction finally took with a study drug, and he achieved remission and had a matched transplant in 2003. 8 years later, he relapsed in December of 2011 and received 2 cycles of the same study drug, and again received a transplant in 2012. And he's back again because he relapsed in July of 2013, and he's being considered for the same study drug and another transplant in the clinic. So what is nursing, and how are we going to explore this topic today? This is the American Nurses Association definition of nursing, and if you can look at the words in bold: protection, promotion, and optimization of health, alleviation of suffering, and advocacy for the patient. And this kind of encompasses all of those facets, the art and the science of nursing, and how we address those as a profession. Specifically, what is nursing science? It's a domain of knowledge. It's about adaptation of the patient to their environments and to the influences around them, and how we can intervene to promote health and prevent illness. So this is more of a scientific approach to what nursing does clinically, the skills we use, and how we translate that to patient care. So as a practice science, this is what we do as nurses, and this is what I've been doing this semester in clinical. So we know skills and techniques. We practice those every day, from medication administration to the clinical documentation of that work. There's clinical knowledge and expertise that's ever evolving and always being developed. Critical thinking is a huge component of this science. So assessing the patient, intervening, and then evaluating those interventions to see if they're successful or not. Evidence-based practice is a huge emphasis in nursing, especially today with research and clinical trials. And then collaboration of nurses with one another and nurses with the greater healthcare team. And I've had to build on my student nurse experience at BC because I didn't have all of this background coming straight into UW. I had to use that knowledge from Boston College to enhance my University of Washington experience. So how do we learn the science of nursing in nursing education? Well, it comes from our curriculum. So we start with anatomy and physiology, pharmacology, pathophysiology, and we learn all of those things in the classroom. And then we apply that knowledge of body systems and disease to patient cases in these mandated clinical hours in nursing education. And finally, it's not so much learned in the classroom, but learned through experience that we can assess ethical, religious, spiritual needs of the patient in order to address their whole person in our patient care. So in this experience, I've encountered many complex and clinically demanding cases where this science and clinical care have been challenged, and that's where these study drugs come in. This is the challenge of nursing, is how do we use these new drugs to help these patients and address these complex patient cases. This semester, I've also done a couple of certifications to supplement my studies. I've done the Good Clinical Practice and Human Subjects Research certifications through the CITI, and these are standards of conducting clinical trials and research. One side is sort of the topics of a clinical trial and how you move through those, and the other human subjects research is more about how do we deal with patients and human subjects in this research, and the ethics side of that and the patient care side of that. So here's how the clinical trial process looks as far as new drugs and developing therapies. So it goes from a small population in phase 1 that has specific measures, so safety, dosage, and side effects, and it moves through the phases to the last phase, which is a large population, and it looks at the bigger picture. So how are these patients doing further down the road and after these therapies? And this is how clinical trials sort of look at Seattle Cancer Care Alliance. So on the website, they have a quote under the clinical trials unit about giving the patients the latest therapies and treatments and giving them new drugs and alternative therapies and conducting clinical studies to advance these drugs. And I had the pleasure of talking to a couple of clinical trials unit nurses who work in infusion but work on that side of the unit. And they talked about the science and the new drug therapies and the skills they need to develop, but they also talked mostly about the art of nursing in that clinical trials unit because there's so much hope there. These patients are often on their last leg of therapy. The stars kind of aligned for them, and they met all of the protocol requirements to participate in these clinical trials. And so most of their experience there is hope that this will be the one that works. And in considering that, we go back to the case study where we look at this patient who's been receiving this same study drug twice before, both with remission and then the disease recurring again. And this is the third time he's going to go through it, but there's still hope that it'll work this time, and this will be the transplant that will work. So as we all know, caring is probably the fundamental core of nursing, and nursing practice is an ethos of respect and reverence for human dignity. So that's the art of nursing, the art of patient care, and ultimately alleviation of suffering. And to quote the foundress of nursing, she focused a lot about environment and the patient environment and lighting and diet and all of those components, but the last line of this really spoke to me as far as the art of patient care is at the least expense of vital power to the patient. So giving the patient the autonomy and the individualized care that they deserve, I think she said it best there. So part of the art of nursing is ethics, and I'm not going to read through all of these because you can browse through yourself, but the 4 pillars of ethics in nursing especially are respect for autonomy, non-maleficence, beneficence, and justice, and that's what we try and focus on as we deal with every patient and address their needs. The art of patient care involves relating to and connecting with the patient as people. They are people first. And you have to understand their background to know where they're coming from in order to provide individualized care and maintain that patient-nurse relationship that's so vital to the work we do. In addition, the sensitivity to cultural diversity. So this is a quote from The Art of Nursing by Gina Bright. And you can see how many facets there are to cultural diversity and how we need to address all of these concerns when communicating with patients and with providing care for them and addressing their needs. So all of these facets of nursing education and the work that we do in the classroom and in clinical come together as we integrate all of these components and put them into clinical practice. So we take what we've learned in the classroom and apply it to our clinical work. We learn the art through observation and experience. That's not something that can necessarily be taught in the classroom. But we look at those who have gone before us, if you will, and see how they've developed their own art of nursing. And this is one study by Peterson and Savanen that I looked at about the impact of these clinical encounters that we have in our nursing education, how they affect our ethical caring. So they looked at, they used reflection, which is a major part of Jesuit education, to look at how these patient interactions kind of translate to development of ethical care. And what they found was that students, when they experience a situation where they can't necessarily alleviate suffering, or they have deficits in their own professional skills because they are students, they become overwhelmed by their vulnerability. But this vulnerability is an opportunity to develop this ethical caring with a focus on the patient. And all of these clinical experiences, academic learning, and self-knowledge and reflection translate to that development of ethical caring. And then courage and compassion especially are necessary to move from that feeling of vulnerability to developing those ideals. What is hope? It's quite a big question. The nursing outcomes classification defines it, but I found a more specific definition that involves 6 dimensions of hope. Living in hope, hoping for something, hope as a light on the horizon, hope as a human-to-human relationship, and hope versus hopelessness and fear. And I think this shows especially that hope is not one-dimensional, and it doesn't mean the same thing for every person or every patient. And knowing this and knowing how a patient views hope and sees hope in their own disease and in their own health helps us to address each patient's specific needs and their own kind of view on their disease and their progression. So this is one of my favorite articles that I read. This is on the culture of faith and hope, and it examined patient justification for their high perception of therapeutic benefit from clinical trial drugs. And the study evaluated whether this was a therapeutic misestimation, so whether these patients weren't knowledgeable on whether these drugs were going to work, or if they weren't given enough information on that, or if it was a therapeutic optimism for their own good. So they interviewed patients in phase 1 and 2 trials, and the majority of patients used hope as optimism. So they thought that optimism would improve the likelihood that this drug would benefit them. They saw their battle with cancer as a source of hope for them, and they expressed faith in God, science, or both aspects. So this really showed that this therapeutic perception of the drug was more for hope than a lack of knowledge about the success that they might see. So hope in nursing, we see it as a component that can't be learned in the classroom. It's learned in our interactions with coworkers and with patients, and it's seen in the advances through clinical trials and research. And so we go back to the case presentation and how Seattle Cancer Care Alliance has managed this complex case, and it focuses on the patient and the family and the ultimate amelioration of his suffering. The staff combines this art of care, research, and compassion in the art of care to provide hope to this patient. So I've made several conclusions that I won't read through because I have said them before, but ultimately nursing education helps us learn both the art and the science of nursing through classroom education, through observation, and through experience. And hope in nursing, we see it in nursing education, we see it in the clinical practice, and we see it in the science of nursing. And finally, we can view the profession of nursing as both an art and a science. And ultimately, our nursing profession is not complete without both the science of clinical practice and the art of patient care. They're integral parts of nursing, and nursing would not be what it is without both of them. And during one of my interactions with a patient, a young man who was moving into the next phase of his treatment, the patient's mother said, "You know, this place gives you hope. It isn't so scary anymore." And I would like to thank Kathleen and Annette, who was my preceptor in infusion, who's not here, and everyone else, because I know all of you. Are there any questions?
Yeah. So you talked about nursing, and nursing here as two dimensions, both art and science, and that hope might be one exemplar of the art of nursing. When you head back to that other coast, that other culture, and if you were to work with a student who is more of a novice than you are in your nursing education, if they're a year earlier, and they're reflecting, they're in field work, they're in clinical, and they're in the classroom. How could you help that student ensure that they saw or they learned from their clinical interactions what hope was and how to sustain it?
Well, I actually work with freshman nursing students at BC as part of like an advisor type role. So we talk a lot about how they're really overwhelmed with anatomy and trying to pass their tests and label the body and all of that. And I think they get a little bit caught up in those technical aspects of education and don't kind of step back and look at the big picture of what it means to be a nursing student and ultimately a nurse. And I think a major component of taking that step back is reflecting on what you've seen at clinical. And not just, I saw a patient with a AAA, which is what I would think of my first clinical experience. How did I care for this patient? You have to step back and see, what did we do as nurses to help this patient, to give this patient hope, to move to the next step of their recovery. So I think that reflection piece of looking not only at the technical skills and the illness and the body systems and all of that, but taking a step back and looking at the bigger picture and how we've helped this patient and how we've inspired hope in this patient.
Do you think a person can best, sort of a very short follow-up, do you think a person, like the freshman that you work with, can they best do it on their own? Or is it best if they share that reflection with someone?
I think it's best to share. I think you can reflect on your own, you can write about it. We write journals, even from freshman year to senior year, we're writing journals about what we've experienced. But I think there's such a benefit to sharing it with other people because you not only get to get it off your chest if it's something stressful, but you get feedback from your peers and maybe from someone who's older and has seen what you've seen or been through that kind of feeling.
I'm curious, as you near graduation and look back on your education at Boston College, do you feel like, specifically the education part, not your personal experiences, do you feel like they have instilled that sense of nursing as an art in you? And if so, can you give a few examples of what they do to not let you get stuck in the bogged down with the facts? You know?
I used to be a tour guide on campus, so we'd know the catchphrases of Jesuit education. One of them is educating the whole person, but I found that to be entirely true. Not only do we educate the mind, not only are we educated in the mind, but we are taught how to communicate with patients in the classroom and in clinical, and that's a huge component of nursing. That's half the battle, is trying to put it in their language. I think, again, reflection is a huge thing, to be self-aware and know your own biases and opinions and assumptions, and then to understand those and then apply that to your patient care and understand where you might have a weakness there and address that. Is that
No,
good?
that's great.
Well,
That's
great.
great. Yeah, that's just great.
I don't have so much of a question, but an observation and a comment to all of you. It was a wonderful presentation, but your one observation that so much of the art, the ethical caring, you learn from your mentors, and you develop your own the way that you practice that art from each person that you take that from. And so I just wanted to take this opportunity to recognize that and thank SCCA and all the people in the room here for your part in developing these wonderful students, because they couldn't do that from the classroom alone. And we really appreciate your mentorship and your part of that.
Thank you, Deborah. I think it was a good place. That was excellent. And from my perspective, I've been, I give lectures on nursing and the history of Hutch nursing and all that. And I love the way you focus, especially on the art of nursing. And I dabbled with that. And I think one of the things that maybe isn't articulated enough is how much there is creativity in nursing when you're looking at a specific patient situation and you're planning your intervention. that's where a lot of the art and independence comes into, you know, what can you do for this patient, and what would you do with this patient's situation as opposed to this patient, pretty much in the same clinical story. And then the other point is, and maybe this doesn't fit as much, is that nurses really make a difference in the moment and the day of. And this came to me way back when a patient of ours died. I'm sorry, this is, well, he touched me. His wife thanked me for the care I'd given, and the patient died, and I was kind of into this medical model. It's like, how could she be thanking me when the transplant didn't work? And all of a sudden it was like, you know, but there was a piece there that made sense because I had done a lot of above and beyond or things for this patient on his daily care that was nursing. And I think nursing can have successes on a daily basis, on a moment-to-moment basis, as opposed to the case or the patient now has relapsed for the third time and we're on the third transplant. Well, what are the interventions now for this kid going through a third transplant? So anyway, nice job.
Very nice. Now, before you leave, Dr. Sharon Fott's going to bring up an award because at the University of Washington, Tacoma, Christen is our very first visiting scholar. And so Sharon went yesterday and picked out a very special award. So go ahead, and the staff that worked on making sure we could get all of the clearance for stuff all signed a card and participated in making this a very, we can't put her per se, but we can sweatshirt her.
I've wanted this all summer.
Oh. And you can wear it now because it's so cold out.
Right.
So we know Christen actually primarily from email exchanges, and we have a whole group of staff who know her voice on the phone, know her clinical clearances, know her email exchanges,
Her
but
baby
have not,
vaccination.
yes, but have not had the opportunity to meet her, but are very impressed not only with you all providing the opportunity for her to learn in Seattle, but for her persistence in pursuing this avenue and in wanting to be our first scholar, and certainly ending up not as a novice scholar, but really quite an expert for where she is in her nursing profession. So
Thank
nursing
you.
gives hugs.
Thank you.